have a couple of things to say. One is that we're going to use the same system with the question card. So if you have any questions at any time while you're listening to the panelists, please write your question on the card and then hold it up so we can see to collect it and pass it on. And I also wanted to pass on some information from our very good friend Randy Hack, who let me know that as far as programs that treat the whole person in Hawaii, there is the Living Healthy Project at the Mental Health Center. So it sounds like we need to find out more about that program. Thank you, Randy. So please enjoy our panel here, and Beth-Ann, the floor is yours.
Let me introduce you. First of all, let's get a mic on. Are we on? No. Are we on? Pushing. I'm pushing it. It looks like it's on.
It has a green light.
All right, we'll switch for the moment. Okay, so many of you know our panelists, but just in case you don't, let me tell you who they are. Dr. Denis Mee-Lee has a long list of credits. He is the co-founder of NAMI Hawaii, the past chief Hawaii Mental Health Division, past director and chair of psychiatry at Castle Medical Center, president and principal investigator of Valdon Medical, clinical professor of psychiatry at the University of Hawaii, past chief of staff at Castle Medical Center, and SAMHSA grant reviewer. Glad to have you here. Public health doctor Jacqueline Chan, we call her Jackie, is the research manager for Valdon Medical, director of lifestyle medicine, wellness, and lifestyle consultant for Valdon Health, and assistant clinical professor at Loma Linda School of Public Health. She was the co-investigator with the Adventist Health Study on lifestyle factors and health outcomes among 96,000 subjects. Welcome. Mara J. Pike is the Community Outreach Manager at Mental Health America of Hawaii and owner of Jasmine Yoga. She is a graduate of NAMI Family to Family Education, a suicide loss survivor, and has been supporting her family and loved ones with mental health recovery for her entire adult life. Welcome. And rounding out our panel, Anisa Wiseman is the program manager for NAMI Hawaii. She is the owner of FloatWise, a sensory deprivation tank, and former special education teacher. She lives successfully in recovery from PTSD and anxiety disorder and cares for family members with serious mental illness and addiction disorder. Glad to have you here. Okay, so we all heard what Paul had to say about 4 domains of fitness. I want our panelists to be able to look through that lens and localize this a little bit. As you look at Hawaii, after having heard what Paul had to say and where he'd like us to go, what his vision is, how do you see that happening in Hawaii? How far are we from that vision? What do you see when you look out at Hawaii? Dr. Mee-Lee.
I first want to say, Paul, that was a wonderful message, and the vision is very, very clear, and strongly support and endorse all that you said. It was a wonderful thing, and I hope we can get a copy that we can continue to watch. I really, really, truly appreciate the tenets included in that presentation. It's like a sermon in a way. It's a message. It's a vision that's very, very clear. I guess the challenge is, how do we operationalize such a message wherever we might be in Hawaii? You know, on one hand, Hawaii has always been known as the healthy state, the state that's been more interested in wellness and prevention, and in general, our health measures are good when we look at any particular condition here. Not always in mental health. When I was chief, we were rated 51st in the country. So we've struggled a little with mental health, but I think the challenge in anything that requires system change, policy change, attitude change, provider change, whatever, we know that that's really, really tough. And, you know, being an old-timer, it's easy for me to look at the tremendous vision of what Paul has presented but struggle with how do we apply that? What do we do with it? And I think one of the things that I would hope would come from this is that the advocacy groups that are represented here, NAMI, MHA, United Self-Help, we need to sort of get together. Sometimes, I was mentioning to Trish, when I was in ancient days mental health director for the state, we sort of were at loggerheads. MHA didn't want us to build any state hospital, and providers and so forth want us to build a 500-bed state hospital. Legislators, of course, always come up in the middle, so we agreed on a 200-bed hospital, which now seems to be too small. But, we seem to struggle to get together on advocacy issues, and we sort of fight with each other. It would be great if we could find at least some common areas, because we need the force of all of us to get any change. Anyone who's been watching what happens in our legislature and in our state government, things truly don't change. It's just really, really sad. And we have, and let me just say this one thing, I don't want to talk too long, but providers really don't have much of an advocacy voice, in my belief. I, as a psychiatrist, always will be seen as having an agenda when I advocate for something. Now, we need to certainly join hands, but greatest change that I've seen come about in this state is when the family members, advocates, consumers speak loudly to our legislators. And if we could join forces together, if we took 3 or 4 of the things that Paul's talked about here, I think we could really achieve some change. So I'll just say that, and we can talk about more specifics.
Dr. Chan.
As someone who is interested in preventing disease by lifestyle means, I was very interested in Paul's remark about how you have to treat the whole person. So my interest is, how do we incorporate nutrition, exercise, stress management, those types of things into helping the mentally ill? Is there any evidence in the research that this is helpful at all? And are there any things going on in Hawaii at the moment that would assist in this sort of thing? Well, there is evidence in the literature that lifestyle nutrition has been beneficial in some of the mental illnesses, and we're seeing much more evidence coming forth. This is not an area that has been researched very well. But I think we will see more and more research indicating that. We've already seen research showing vitamin D is helpful, omega-3 fatty acids helpful, just a regular healthy diet. And if you look at chronic diseases, if you look at the research that shows what's beneficial for chronic diseases, it's really interesting to find that all of these, like the dietary recommendations, the exercise recommendations, they all seem to be very, very similar, right? They're sort of all coalescing to be quite the same. And I wouldn't be surprised if future research shows that what is good for physical health also benefits mental health. In New Zealand, there's a lady, Julia Ruckledge, a professor at University of Canterbury, who's looking at micronutrients, and she's done much. She has about 138 published papers that look at micronutrients and their beneficial effects for mental health. She used this treatment for the people in the New Zealand earthquake, if you remember the earthquake, and had some very, very good results from there. And as far as locally here in Hawaii, what's happening? Well, I don't know if you've heard about Blue Zones. Have you heard about Blue Zones program? Yeah. What they're starting here they've got one place located in Oahu, 3 other locations are coming up now, and what they're trying to do is make healthy choices easy choices, because we all know that it's hard, even if we're well, to make healthy choices. So I'm hoping that by the improvement in and they're going at policy level too, at state level and county level, and by making the healthy choices easier choices, this will also benefit the mental health patients as well.
Dan Buettner has been in town several times, and the Blue Zones has been expanding locally too. Lots, you're very right in all that, but good book to read. All right, I think that brings us to you, Mara.
Hi. So I think the way I'd like to start talking about my experience is to go back to when I first moved to the North Shore and started a yoga school, and was teaching for the community and also studying here in Honolulu. And I had had experience in my adult life with family members struggling with mental illness, and actually with my peers starting in middle school. So I had some just lived experience and didn't really know what I had been doing over those years as far as supporting others who were struggling. But I found in the yoga classes that people were disclosing to me as their teacher and thought I would have answers. And I was like, I can teach you how to be strong and flexible, and I know the body and mind is connected, like that's the whole point. But I didn't know how to speak to these really personal stories that people were telling us. And I had a good number of years of experience prior to this, but I really found because I was up there for 12 years and I started teaching pregnancy yoga and mom and baby yoga and really working with a whole range of ages, that this was not, it was common, and that people didn't have a place to talk about it. And I don't necessarily think the yoga studio was the appropriate place because none of us as teachers had any training. So it wasn't until 2014 when I actually cut back on my teaching and started working with Mental Health America and moved into Honolulu that I was exposed to all these wonderful free trainings that were offered. And it brought to light for me all these experiences I had had from my childhood until current day, that the information was out there and I didn't know how to find it. And it was just through certain life choices. I didn't mean to make a healthy life choice to get more education, to learn how to help my family better, to help my friends better, to help my students, and also fellow yoga teachers, right? We would kind of get together and try to troubleshoot the things that our students were telling us. So it just showed to me that there was so much, people were help seeking, people were finding things that helped them, but it wasn't quite enough. I didn't feel equipped to handle what I was told. So I was also I started counseling for myself at age 17. I had heard it's supposed to be good for you. I didn't really know why I went, but I kept going. I'm still going. It took about 20 years to find a provider that really actually, I got it. It's supportive, it's lovely, it's current day, and it was just this eye-opening experience. So I felt very fortunate that my health insurance covered this, right? And I never knew when I was younger that health insurance covered that, right? It was these things that I just didn't get the information young enough that could have helped a little bit more in some of the situations I ended up in. So I think that what I'm really proud of locally that I think can really make a difference is the Prevent Suicide Hawaii Task Force. It's a statewide network of agencies and volunteers and advocates, and we were tasked by the legislature last year to create a prevention plan for the state to reduce suicide by 25% by 2025. I know that that is a lofty goal, but the thing that I love that we brought into the plan, it's similarly modeled with our national plan, but we're talking about hope, help, and healing, which is talking about prevention, intervention, treatment, support services, and how we're doing a little bit of a lot of those things in different places across the state, but we need so much more to be done to be available. But I think that there's now this comprehensive report that the task force did, and the youth voices encompassed into it. I work with youth here. We have a youth leadership council for suicide prevention. But the thing I've noticed is that when we say the words suicide, even though prevention is in there, people are a little taken aback, right? So we also are trying to talk about mental health awareness, and we're trying to also make sure that people have a way to talk about wellness. So I think overall, having prevention as wellness and kind of trying to have that messaging and that language around that so it's accessible to everybody is really kind of where I've come to with this. And I think the fact that there is so much education out there to be had and it's just more people can be exposed to it, that's kind of my goal.
Thank you, Maura. Anisa.
Hi. There's a couple things that I wanted to touch on based upon what I heard today. First of all, Kauai Police Department just recently trained 13 of their officers in crisis intervention training. They're training recruit classes in mental health first aid, and the whole police department is about to be trained, so there's about 150 of them, and she will train 20 to 24 at a time. Also, Maui was trained several years ago, and they've seen a 60% decrease in arrests of the mentally ill. 60%. The other thing that I wanted to touch on as far as like whole person is healthy relationships and how important that is. And for me, like, that started with myself. It's when I finally realized that, you know, I can't change anybody else but myself. And that's where I started. I found my power there. And instead of judging, because I think a lot of the time I was just judging my family members, and instead of judging, I tried to understand and started asking the question, what happened to you, instead of what's wrong with you. The other thing that I wanted to touch on too that he was talking about was addiction. Especially I think for my brother, he suffers from addiction, and I know for him, when we were children, when your fight or flight response turns on, there's like 3 things that you can do. You can fight, you can run away, or for him what he did was he tuned out. So he tuned out, he didn't deal with any of his emotional pain, but it was still there. And so his addiction is just himself self-medicating, and he just has a lot more negative side effects than other people. And then the last thing I also wanted to touch on was I started meds and seeing a psychologist when I was like maybe 15. And I was going to a psychologist and I was taking meds expecting my healing, like I went to this person and I thought, oh, this person is going to make me better. And I took these meds and I thought, oh, these are going to make me better. But I needed to make myself better. And the meds and the psychologist were just tools that I needed in order to do that. But nobody ever said like, hey, look, Anisa, you're going to have to roll up your sleeves and you're going to have to do some work. Nobody ever told me that. So, yeah.
Thank you. All right. Threaded through a lot of the discussion today has been how we talk about mental health, wellness, mental illness. We hear those terms. And the fact that we've been dealing with stigma for such a very long time. But very recently, just within the last couple of months, we've seen some younger celebrities come out and openly talk about their issues. And that seems to have generated, or at least the perception is, that we're talking more about mental illness and mental health now than we have perhaps in the past. My question for all of you is what you see in that, and are we in fact seeing mental health becoming more of an open topic, mental illness becoming less stigmatized? Is this really a moment, or is this something that moves beyond a moment where we're just seeing a sense of convergence with what many folks here know, which is that you don't separate body from mind? Anybody want to go first? And we don't have to go right down the line. It doesn't have to go that way. Whatever way you want is fine.
In my youth, I always reacted to mental illness and mental health as the terminology. So when I started the psychiatric program at New England Memorial Hospital in Boston, I called it the Department of Human Services. That was before human services was more generally used for human services. So it was an attempt to try to soften the sense of what mental illness is about, to call it a human issue, and we started programs that were based on that. And as I've gotten older, I guess in some sense I've retreated to what's in a name, and is the name the most important thing? Behavioral health, a lot of people didn't like that, and so forth. So I'm not sure that it is a name issue, although maybe it helps a little bit. I think it's partly this issue that and it's not just being the others that have separated mental health from health. I think in many ways we in mental health have advocated for being separate and being a cut-off section of the health system and the reimbursement system and whatever. We've also protected confidentiality that Paul referred to. So I think in some respects, it's a marriage that has to take place both ways. We have to be willing from the mental health side and from the general health side to create systems that actually put the person back together. The APA, the American Psychiatric Association, is pushing collaborative care, models that bring behavioral health, psychiatry, whatever, into the primary care setting. And I think if we could sort of push that kind of idea so that we didn't think of a mental health center and a health center, but we had one whole person health center where we really work together in the same system, I think we would be doing a lot to break down those kinds of stigmatizing barriers that do, I think, then translate into when we're a provider, we almost treat the person with those same kinds of barriers. So I think there are system things that we need to push at a single clinic level, but certainly legislative, and we could do a lot in this state to develop more of that integrated model of care.
Do you see, though, that this idea of watching celebrities talk about it more openly? I mean, when you hear Beyonce, when you hear Adele, when you hear Kevin Love talk about what they're facing, does it make it easier for particularly younger kids to be able to talk about this? Is this good modeling, or in some cases, is it not such good modeling?
I don't know what the research shows on that. I mean, I think it just seems sensible that the more people who talk about it, who seem normal on the outside, it must reduce some of the stigma. But I'm not sure what, we've had people that have come up about that over the years or the decades that I can think of, and I'm not sure that it's made a big difference or not. I mean, I think it's good. It certainly is not a bad thing, but I think we got to do much more at the ground level of integrating what we do, and I think there are things right here in Hawaii that we could start doing towards that right now. Yeah.
Do you want to take that? Okay. Either of you want to talk about that a bit?
Okay, does this work? I think as far as like a whole person, like all these other aspects, those are just breadcrumbs to show us the root of the real problem. And when we look at the whole person, then we can use those breadcrumbs to find that root. I can't recall the other thing I wanted to say.
I guess I could say that I think it does help to have role models disclose. I think it's really hard to disclose. I think it's really hard to advocate on behalf of the people you love. So I think it takes so much courage to come forward and do that. And I think the thing that's been interesting for me, the conversations I've had with the youth recently, is, they're not having, there aren't other adults in their lives talking about these things. They're not talking about it in health classes. They're not talking about stress and the connection to your mental health. Those connecting the dots, I think, is to me something that I'm hearing is not happening here. But I think sometimes it's also, you're getting a snapshot. So like you're looking at a celebrity who's living and making it through and saying how hard it is, but that's kind of hard to be like, well, I'm not Beyonce, I don't have, there's a relationship to that, but it's also not sort of relatable to like your friends and family. But I think it is important to have people talking about it and using those words. And I think the thing with our youth we're talking about is sort of like, what words would you use? How do you talk about this with your friends? Because I think a lot of what we know is happening is that peer-to-peer is happening very young, and they're trying to help each other as best they can. And there's that disconnect with the adult relationship. So I really think it's that if we have other adults that can talk about it and are willing to talk about it and share what helped them get through it, you're giving those tools. And I think the other thing around media and messaging, and that can be dangerous. There isn't always safe messaging. And I think when we hear mental illness, and I think when there are, violent crimes, right, it gets spun. It gets spun in a way that you don't see that anybody could have a mental health challenge. Anybody could be at risk. We're not seeing that part, right? It's like you're just sort of seeing extremes. So I think our media could be really helpful in humanizing it a little bit more and sharing those resources.
Okay, can I go real quick? Go ahead.
You remembered.
Yes, I remembered. I wanted to say that I think that also starts with like us, with sharing your story and finding your power, because like I recognize that it's my privilege to be up here and talking about my story. At one point I could not be up here and talk about my story, and so when you do have that privilege, take it and do it, because that's your power. And the other thing I wanted to say was NAMI's about to roll out a new program called Ending the Silence, and we will go into classrooms and we will talk about mental health and try to change the conversation and the youth's attitudes towards mental health in general, so that if and when they do need help, they know how to seek it, but they also know how to be with their peers who are needing the help too, and to have that relationship with them as well.
We've talked a lot about how different segments of our population live in isolation. The same might be said of those who engage with the healthcare community and the healthcare community itself. Do you really see that the mental health community is working as well as it could? You've sort of alluded to it a little bit, Dr. Mee-Lee, a little earlier, but what would you specifically like to see this mental health community do to be able to create that voice of advocacy? Here we are in this tiny place, and yet it's taken many different parts of our community a while to come together. Look at what happened over homelessness, when it really took quite a while for different organizations to stop acting in isolation or to understand that they had things that were in common to each other, and they were able to do a little bit more together by working together. Certainly it takes a lot to get over that sort of fiefdom mentality, which has been pervasive in a lot of nonprofits, and we've got lots of nonprofits here. But how would you like to see this mental health community, and many of those who aren't here today, work better with itself?
I think, Beth-Ann, to answer your first question, I think to me it's pretty clear that the mental health provider community does not work together. It's very particulated, it's very separate, and whether you call it fiefdoms or whatever, I think it's just a lot of lack of communication and collaboration. Queens has just cut a lot of beds, other hospitals didn't know about it, and then there's no integration around inpatient care. If you just take that as an example, there's no integration around outpatient care. The problems in connecting inpatient to outpatient, and to when you add prevention and health orientation, those pieces just unfortunately don't work together. I mean, we just have to face that reality. Why is that? I think the main forces, to me, that can really make change, I alluded to earlier, are advocacy organizations. I really don't believe the provider organizations have much incentive to get together. I don't know how many psychiatrists are here today. I think Dr. Westwell is over there, but I think it's an indication that there's not too many providers here. We don't bring that sort of force together, even though we have very important meetings like this. So I would like to see, we've had occasional legislators, right? We do have a mental health task force meeting right now in the legislature. I don't know who's going to that, but I don't sense that there's a lot coming out of that for change, for real change. There's issues being discussed. I would love to see that, seeing we have 3 entities represented today, that we set a meeting after this to try to see how we can work together. NAMI's going into schools talking about teachers and kids learning more about mental health. Bud Bowles goes into schools all the time. But do you ever talk together? Do we know what each one is doing? I don't think we do know. MHA is doing a lot of community education prevention things, but we don't collaborate even what we do. So I think we really need to take a step from this meeting today, not just be inspired by the great words, but that we really do try to get, say, the 3 of us together and try to think about what can we focus on, a few areas that we want to make some real change in, and let's work on doing it. I'd love to see that. I sit on 2 of those boards. I would love to be able to help in trying to pull things together too.
Would you like to jump in? The 2 of you want to jump in on this? How do you think that we should see more collaboration? How would you like to see? You talked a lot about how we talk with youth, how youth talks to itself, peer groups. the fact that we know that kids are going to listen to other kids more than they're going to listen to anybody else they don't think is a peer. How do we begin to fold that in? Because it's taken a long time even to recognize that homeless youth are not just those kids. I mean, we just had the street youth study, which disabused a lot of ideas about what those kids were all about. How do we do that with kids who are dealing with mental illness as well as maybe other issues as well? And how do we begin to fold that into this larger conversation and make it a germane part of it?
I'm going to go back to the prevention aspect of it. I'm also about to roll out a new workshop through my own business, a coping skills and emotional intelligence workshop for grades 1st through 3rd I'll start with. And it's just going to be on a Saturday at my house. But when I was young, I didn't have I wasn't self-aware to know what I was feeling, first of all, nor did I have any healthy coping skills to pick up. And so instead of picking up the healthy coping skills, I picked up all the negative ones. And so as a child, when a child is having a tantrum, that's not when you teach them the coping skills. They are not ready to learn when they are having a tantrum. They're ready to learn as it needs to be integrated into their daily lives. You know, if I can't teach a child to smell the flower and blow out the candle while they're having a tantrum, but if I integrated that into their life every day, then when I'm having that tantrum, I can go straight to okay, let's practice this coping skill, let's go there. And I think that's where it comes from. It's the prevention. It's teaching kids about emotional intelligence and what their feelings are, and that it's okay to feel those feelings. I think that's really important, and we undervalue that. And so I'm trying to bring it back up and into reality.
So how are you integrating that with some of the other auspices that are out there, even the DOE?
Well, like when I taught special education in my own classroom, I integrated a lot of this already into my lessons. But it's also, you have to think about the way children learn. They need to be motivated. They need to see value in what they learn, and children learn through play. And that's the other thing with my workshop. Like, it's going to be, we're going to play a lot, because in play then comes conflict, and then that's an opportunity to learn. But you have to teach them correctly, and you have to teach them at the right moment. As far as the DOE goes, I'm not there yet. There's a reason I'm not there anymore.
If you ask permission from the DOE, you get a no answer in 5 minutes.
Always. Yeah, the teachers, they want it. They want help in the classroom. We went to the HSTA fair, and we talked about our Ending the Silence program, and all the teachers are like, gimme, 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 because they need help. They need more support, and this gives them the help and the support that they need, because they're the ones in the classroom that are trying to get to these kids. They're the ones dealing firsthand with these emotional problems. They have the kids for most of the day, and they want the help, and they need it, and hopefully we can give that to them.
So what did HSTA say to you when you said to them, look at what I'm experiencing with all these other teachers?
So it was like a fair where the teachers came to us, and all the teachers, they took our information and...
Have you approached HSTA?
No, I haven't. Well, they're the ones who had us there at the fair.
But I mean, in terms of advocating for this, if you want to be able to move that needle a little bit, if you're looking